Colombia is one of the few countries where euthanasia is legalized. Since 1997, euthanasia is recognized as a fundamental right in the Institutional Court for Terminally Ill People. Despite this fact, it is very difficult to have an access to it.
The first euthanasia in Colombia was practiced in 2015 via tutela. But what about people who have a non-reversible degenerative disease, such as Alzheimer's, Parkinson's, hemiplegia, sclerosis, and among other diseases? Last July, the Constitutional Court of the country extended the right to dignify death to those who suffer intense physical or mental suffering due to an incurable injury or disease.
There are a lot of people that compare euthanasia to murder, and the evidence a lot of knowledge and ignorance about this murder. Imagine for a moment that you are diagnosed with a terminal cancer, that you have a tumor in your head that cannot be removed, and that you will be given chemo and radiotherapy, which will not help at all, and will eventually cause damage to your head, body, etc.
Imagine that you suffer from excruciating headaches, your body begins to deform, and the only thing you can do is apply morphine every hour to avoid feeling so much pain. This happened to a 23-year-old girl from Arauca in 2017. After several legal struggles, she managed to access euthanasia. Does this really seem comparable to murder?
Let's analyze another case. In Bucaramanga, a young woman was diagnosed with epilepsy from the age of 2. And underwent surgery to cure it, but complications arose during the surgery and she remained in a vegetative state for 8 years, until it happened.
The mother requested euthanasia because she could not bear seeing her daughter, with red spots all over her body, constant legs, cramps, and shortness of breath. The young woman died before they accepted to give her the euthanasia.
Finally, let's talk about on the most discussed recent case. On Sunday, October 10 of this year, 51-year-old Marta Sepulveda was going to the first person in Latin America to use euthanasia without having a terminal illness. She suffered from an amyotrophic lateral sclerosis, a degenerative disease that attacked to the nervous system. According to her son, she cannot independently clean herself, go to the bathroom, eat or brush her teeth. Imagine depending on someone else to the simplest task.
The Interdisciplinary Scientific Committee of IPS in Condol suspended Marta's euthanasia hours before its application. This because, according to them, she did not meet the requirements to access the procedure. Marta was denied the right to die with dignity after failing to live with it.
However, degenerative diseases not only cause bodily consequences. According to a psychology study from the Center of Clinical and Psychological Health located in Almeria, Spain, 30% of patients with chronic diseases tend to suffer from depression and anxiety, thanks to an adaptation forced into a given disease.
We are full owners of our body, and we have the right to decide how we want to live. We have to consider the autonomy of the patient.
And the right of a terminally ill person to determine when their life is no longer worthy, and to end their existence in a dignified way, avoiding harmful suffering.
Euthanasia offers options, and not everyone accepts it, but it can be comforting for patients to have a choice. We have to talk about euthanasia from the right of decision and empathy. Let us remember that we all have the right to a dignified life and death.